Today's topic is cancer. We'll just briefly go through the different types of cancers. What is cancer? How it happens? Okay. What innate system you have in your body to prevent the cancer cells from happening or cancer mutation to take place. Okay. So all those things in detail we'll take. So cancer is a disease in which some of the body's cell they grow uncontrollably and spread to other parts of your body. Okay, we can see here in the image how a normal cell structure looks like and how the cancer cells they are not at all similar to the normal cells and they don't grow in a normal pattern. Okay, if you see on the right image, there are columnar cells and squamous cells piled on top of each other in a specific sequence. Okay, the growth of cancer cell is not in that sequence. Okay, it can grow in any direction. It can infiltrate. You can see here it is infiltrating much deeper into the skin. Okay, so cancer can start almost anywhere in the human body, which our human body is made up of trillions of cells. Okay, normally human cells grow and multiply in a controlled manner. Okay, they form new cells as and when the body needs them. Okay, and this process is called cell division, which is normal in a very controlled paced manner. The human cells divide and multiply. Okay, when the cells grow old or when they become damaged, they die and new cells will come and take their place. So that is how it happens. But sometimes this orderly process breaks down. Okay, and abnormal or damaged cells they grow and multiply where they should not. Okay, in a different base or in a different site area, and these cells may form tumors. Tumors are lumps of tissue which are removable. Okay, you can dissect them and surgically remove them. Okay, but tumors can also turn cancerous. Okay, they can either remain benign, that is non-cancerous, but if they start spreading and the tumors start spreading, we call them malignant or cancerous. Okay, symptoms: fatigue, lump or area thickening that can be felt under the skin, weight changes. Okay, because either you may lose weight or gain weight depending on the type of cancer. Usually it is weight loss because the nutrients required for nutrients, fat and all, that is carbohydrates and all required for the normal cells growth, is now directed towards the growth growth of tumor cells. Okay, which is not benefiting the human body at all. So weight changes will take place. Skin changes such as yellowing, darkening, redness of the skin, okay, sores that won't heal, or changes in the existing moles. This can take place, especially when it comes to skin cancer and all. Okay, changes in the mole means the you know how a normal mole that you had since a very long time, how it looks like, how the border are. It's very clear border and all. But when cancer happens, the border of your mole or what may become irregular. It will spread in any direction. The size, the texture of the mole will change. Okay, so that is, and changes in the bowel or bladder habits, the regular schedule that you had for your bowel and bladder movements that may shift. Persistent cough or trouble breathing that can take place. Nagging cough, which can last for more than 4 weeks. Nagging cough that can last for more than 4 weeks. Difficulty in swallowing food, especially when there is a nagging cough, or any esophagus, oral cancer, or oral tumors, thyroid tumors, and cancer, if it is associated with that, difficulty in swallowing will be there. Hoarseness in the voice changes, then persistent indigestion or discomfort after eating. And persistent unexplained muscle pain, joint pain, again, it depends on the site and size of the tumor where it is. Unexplained fevers, night sweats, bleeding and bruising under the skin, blood clots that get trapped under the skin. Okay. So these are the signs and symptoms. It depends, okay? Cancer is of different types, okay? Any part of your body can, the mutation can take place and a cancer can begin. So depending on the part of your body also, the signs and symptoms are very different, okay? But your bowel pattern, bladder pattern, hoarseness in the voice, nagging cough, when you get a mole or wound that is not healing properly. So these things are very common with cancer cases. So cancer is caused by changes or any mutation that happens to your DNA within the cells. DNA and RNA is present inside the nucleus of your cell. Okay. DNA inside the cell is packed into large number of individual genes. Okay, and these genes can undergo mutation. And each of these genes, they contain a set of instruction. Okay, so these genes will tell your cell how to perform, how to function. Okay, how to grow and divide as well. Okay, it is under the control of these genes. Genes are the ones that tell your cell what to do, what not to do. Okay, without the genes, cell is just a living, like a living cell. Okay, it is just alive. It does not know what to do, what to create, how to function. Okay, everything is under the control of genes. So if at all there is any error in this instruction, okay, especially in the error in growth and division, okay, the cell will not know when to stop, how to stop. Okay, the cell will keep on dividing, okay, because the gene is not giving the instruction to stop. Okay, if the gene has undergone any changes, if the gene has undergone any mutation, specifically the gene which is responsible for division and growth, if that specific gene has undergone mutation, the cells will not know when to stop. Okay, and that's how cells become cancerous. It just takes a single cell, one gene in a single cell to undergo this mutation and cancer to take place. Okay. Then, type of genes that cause cancer. These topics are not from textbook. The classes that we take on Wednesdays are not from textbook. Okay, these are extra classes. So the genetic changes that contribute to cancer, in which three type of genes are the main genes that are supposed to protect you. Okay, so you have procto-oncogenes. They are involved in normal cell growth and division. Okay, if these particular gene, procto-oncogene, undergoes any mutation, they can become cancer causing. Okay, they will not stop the cell from division and growing. Okay, because procto-oncogenes are involved in normal cell growth and division. If something wrong happens to them, if a mutation happens to them, the genes will continue to grow and divide when they should not. Okay, so that's how procto-oncogenes are responsible for cancer if any mutation takes place. Otherwise, they are the ones who control uh, cancer from happening. Then you have tumor suppressor genes. From the name itself, you know. Okay. If at all these genes understand uh, one cell is dividing in an uncontrolled manner, they initiate their action. Okay. They will make that cell stop doing that. That is tumor suppressor genes. Okay. They are involved in controlling the cell growth and division. Okay. And if at all anything goes wrong with tumor suppressor gene, okay, what happens is that even though there is a cell that is dividing and growing uncontrollably, and the tumor suppressor gene cannot identify it, there is nobody to stop that cancer from happening. Okay, so even if the procto-onco genes fail, any mutation is taking place here, at least you have tumor suppressor genes to control the situation. But anything goes wrong here, okay, then we have only the option of DNA repair genes. They are involved in fixing the damaged DNA. Okay, so what they do is they keep an eye out for all the cells that have some degree of mutation going on. Okay, they will go and repair those changes at the genetic level. The DNA repair genes will switch it back to normal. Okay, they will either duplicate or delete some chromosomes, and they will switch it back to normal. Okay, but something is wrong with the DNA repair genes as well. If these genes also undergo mutation, there is nobody to help repair the broken genes of a cell, and that's how cancer take place. Okay, so what do gene mutations do? Either they lead to rapid growth. Gene mutation can tell a cell to grow and divide more rapidly. This creates a lot of new cells. All of that will have the same mutation. Fail to stop uncontrolled cell growth. Normal cells know when to stop the cell growth. Okay, so that is the tumor suppressor cells. Okay, when they cannot, they fail to stop this, cancer cells will lose control and they will keep on growing. Okay, mistakes when repairing the DNA errors. Usually, everyone undergoes DNA errors at some point of their life. Okay, we are not even aware of it. But the DNA repair genes that we have, they take care of it silently. Okay, but when the DNA repair genes are not doing this work properly, they are not correcting the errors. Okay, that's those cells can become cancerous. So these are the three main areas through which the genes that we have discussed right now, if something goes wrong with them, these are the three main areas through which a cancer can take place. So what causes this mutation? What should happen that these genes that we have discussed, okay, tumor suppressor, DNA repair, procto-onco, what should happen that these genes will undergo mutation? Some mutations you are born with, okay, that is inherited from your family. Like certain types of cancer, they run in the families. Colon cancer, any female reproductive, male reproductive cancers, okay, gastric cancers, tumors, brain tumors, okay, these things run in the family. There are very small percentage of tumors that run in the family. So you are born with a genetic mutation of a risk for cancer because it happened in your family. Okay. Then the gene mutation that occur after birth. Most gene mutations occur after you are born, and these are not inherited. Usually, the environment that you live in plays a very important role here. Okay, and also the lifestyles that you have, like smoking, drinking, okay, exposure to radiation. Like if a person is a radiographer, or you are posted in a radiology department, or you work with the nuclear medicine department, or in an atomic energy plant, okay, you are exposed to certain degree of radiation, higher radiation as compared to an average person. Okay, so these can also cause mutation. Some viruses like human papilloma virus, Epstein-Barr virus. Okay, these are the two viruses which can cause cancer. If you're infected with these viruses, it can cause cancer. Cancer causing chemicals, carcinogens. like in tobacco and all. Okay, obesity, certain gastric cancers, colon cancers are high among people who are obese. Hormones, fluctuated hormonal level, chronic inflammation, and lack of exercise. Okay, so these are the reasons that can lead to gene mutation. Then types of cancer, carcinoma. So if your epithelial cells are involved in any type of cancer, we call it carcinoma. Okay, there are different types of epithelial cells: columnar epithelial cells, squamous cell, basal epithelial cell. Okay, uh, different types of epithelial cells are there, usually found in the mucous membrane, the lining of your body inside, okay, inside your body, wherever you have the stomach lining, intestinal lining. Okay, all these area linings are made up of epithelial cells, different types of transitional epithelial cells. Okay, there are different types of epithelial cells. So if these epithelial cells are involved in mutation, it leads to carcinoma. Okay, it's the most common type of cancer. Epithelial cells are all over your body, inside out. Okay, so that's why it is the most common one. And based on the type of epithelial cell which has become cancerous, there is a different medical terminology for it. Okay, for example, adenocarcinoma, epithelial cells that produce fluids, specifically hormones and mucus that secrete something. Okay, like pancreas, pituitary gland. Your intestine also have a lot of small glands that secrete mucus. Okay, so epithelial cells which are capable of producing an enzyme, fluid, mucus, hormones that is been released into somewhere else. Okay, that is a uh, glandular cells we call it. It's an epithelial cell. So if any glandular cell is involved in cancer, we call it adenocarcinoma. Basal cell carcinoma if the basal cells are involved. Okay, if you can see here in the first image, see if you can see this part, this area. This is a basal epithelial cell, very close to the border. Okay, it forms the base of any cellular structure. So this one line, that's the basal epithelial cell. Okay. Squamous cells, if squamous cells are present in your cheek, okay, usually in oral cancer and all, squamous cells are affected. Okay. Sarcoma, cancers that form bone, that form in your bone tissues, soft tissues, muscle, fat, blood vessel, lymph vessels, any fibrous tissue, okay, like tendons and your ligaments. So if any cancer happens in these kind of tissues, we call it sarcoma. Okay, you can see osteosarcoma image is given. It's a bone cancer. Okay. Then leukemia, the cancer that begins in the blood forming tissues like your bone marrow, spleen and all. Okay, that leads to leukemia. So here you don't find a solid tumor because blood is a fluid connective tissue. Okay. So you don't get a solid tumor here, but you will see abnormally large number of cells in your blood. Okay, way too many blood cells. Okay, you can see the image here. A normal blood, how many leukocytes you will have. Okay, as compared to leukemia, the white blood cells, leukocytes are overtaking the red blood cells. Okay, crowding will take place. and it will be difficult for oxygen to reach your tissues, because red blood cells are supposed to give oxygen to your body, okay, to your cells. And if white blood cells are overpowering the red blood cells, you will not get enough oxygen to the tissues, okay, and you will not even have enough amount of platelets as well. So bleeding will be difficult. Like if you get hurt and blood is coming out, to blood clotting will be delayed, okay. And fighting infection is also difficult, even though it's you have too many leukocytes. Most of them are immature, they are not normal functioning cells, okay. So the body will not fight infections as well. So that's leukemia. Then you have lymphoma, cancer that happens in your lymphocytes, where lymphocytes are involved, okay, T cells and B cells. So these are the disease fighting cells of the immune system. And in lymphoma, it's like you may think that, okay, we get a lot of disease fighting cells here, but they are not normal, okay, they are immature, they are not normal functioning cells that happen during cancer, okay. So abnormal lymphocytes will build up in your blood, in your lymph fluid, in your lymph vessels, nodes and all, okay. And there are two types of lymphoma: Hodgkin lymphoma, non-Hodgkin lymphoma. So in Hodgkin lymphoma, abnormal lymphocytes are there, and usually it is the B cells. Non-Hodgkin lymphoma, this is a large group of cancer. Again, lymphocytes are involved here, and the cancers can grow quickly or slowly, depends on the site of the lymph node. And here both T cells or B cells can be formed. Abnormal B cells and T cells can be formed. In Hodgkin, it is B cells. Okay. This in detail, you don't have to know this, but just for your information. Then you have multiple myeloma. So myeloma is a cancer that begins in the plasma cells. Plasma cells again from the bone marrow. Okay. So abnormal number of plasma cells will be building up in your blood. Okay. And it can lead to tumors from the tumors in the bone, and it can spread throughout the body as well. Then you have melanoma. Melanoma is a cancer that begins in the cells, and that becomes melanocytes. Melanocytes contain this pigment melanin that gives color to your skin. Okay, and so in melanomas, you will see pigmented tissues, abnormal pigmented tissues, or even your mole and port. Okay, the pigmentation changes there. Okay, and even in your eyes, okay, the pigmented tissues wherever you have in your body, there you will see the changes. That is melanoma. So this is how different types of melanomas look like. Okay. Then you have the brain and spinal cord tumors. There are also different types of brain and spinal cord tumors. These tumors are being based on the type of cells which get cancerous. Okay, you have like astrocyte, dendrites. Okay, there are different types of cells in the brain. So based on what type of cell has undergone tumor, names are different. Okay. So if astrocytes are the ones that have been affected with tumor, you will get astrocytic tumor. Okay, that is how the naming is done. So that's about cancer. If you have any queries,